Hi, this is Dr. Jay Park with Cosmetic Medical Training. Cosmetic Medical Training has been specializing in Botox and Dermal Filler training for nurses for over 10 years. We often get nurses who want to change their career from their standard medical practice. If this is you, then here's a basic checklist that you should go through before you sign up for our training. Number 1, state regulations. State regulations are constantly changing. We always recommend that you check with your state licensing board about the legality of your practice. For example, in Florida, the board has stated that Botox injection is outside of the scope of an RN's practice. Texas, the board has not restricted LVNs to inject Botox, but have other strict requirements. In California, the good faith exam law requires a physician, a nurse practitioner, or a PA to examine the patient before certain procedures, and so on. The laws are so varying that you'd have to have a lawyer to keep up with the constant changes for all 50 states. Even if you are a nurse practitioner, there are strict requirements about the business setup and the supervisory requirements. Each state is different, and therefore you need to get some legal advice or contact your state licensing board. We also recommend that you don't trust anyone else, any kind of web pages or forums that you may find about state regulations, except for your state licensing board. They're the ones you want to talk to and get the information from the ones who make the legal rulings. We've had situations where people have gotten bad advice and have been burned as a result of it. Number 2, getting a job. Now, the field of aesthetics is very competitive. While there are many vacancies in your area, I'll bet you that 99% of those jobs are looking for somebody with experience. So the question is, how do you find experience when you're new? Well, it's very difficult to get your foot in the door, and it's even harder to find the right door. The right door means that your future employer is compliant with all state regulations and supervisory requirements. There are many news reports of nurses who've been arrested for practicing illegally, especially in Texas. The nature of our training requires that a nurse or a nurse practitioner have an office. And we get many phone calls from nurses who don't have any idea of what they will do when they finish their training. So we always tell them to wait to have the proper structure in place. After all, it is best to get your training and start injecting more patients in the following weeks to reinforce your training. The worst that could happen is that you wait months after your training to even start injecting any patients independently because you're looking for a job. When you start this again, you're going to feel like a beginner, and the muscle memory as well as the memories of the teaching pearls will have been distant memory. So we recommend the following. Really, get the correct supervision in place. Speak to a doctor that you like and convince her or him to join you on this venture. Having a partner will also reduce your startup costs, office costs, supplies, marketing, etc. After all, you'll need a medical director to order Botox from Allergan anyways. You really should set this up first. If you are still adamant about getting your training first, then looking for a job, then go for it. Good for you. Be tenacious and don't give up. It will definitely help if you're in a large metropolitan area like New York City or Dallas, where there are multiple opportunities.